Now, there are people in Colorado right now who need medicine, but unfortunately they can't afford it.
Yeah, that's why some lawmakers are trying to launch a drug donation program across the state. Now, news reporter Anusha Roy joins us live from the Capitol. Anusha, how would this work?
Yeah, it's essentially creating a network across Colorado to collect these prescriptions and non-prescription medications and really prioritize donating them to people who are underinsured, maybe they don't have insurance or otherwise would not be able to afford these kinds of medications. The Colorado Society of Pharmacists actually shared a study from 2021 that shows nearly 10% of Coloradans right now cannot afford their medications, and around 40% of those people said that they're now feeling more and more sick because of that issue. They also said in that study that it's up to billions of dollars worth of medications that are being thrown away every year in the U.S. Now, the way the bill is written right now is it would expand who can donate and when, including individual people, pharmacies, government agencies, and from healthcare settings. And then those medications can be donated to designated sites, again, including multiple different types of healthcare settings. As you can imagine, there is a lot of safety that has to be incorporated into this, and that is why the bill is asking for a licensed pharmacist to inspect all of the donated medication, requiring good record keeping, including the type, the condition, and the age of the medication, and throwing away anything that doesn't meet those standards. The Pharmacists Society says it's also going to be really important to make sure that there is no liability involved in this and that it is voluntary on all sides. Now, this group is very much on board with the idea, said it's actually been in the works in Colorado for several years at this point, and they really do want to find a way to reuse medications instead of throwing them out. But what is going to be very critical is creating a sustainable program so that people can rely on it, right? We're talking about people's medication, and a big question is going to be the workload for pharmacists as well. And so the way that this is being written right now, Corey and Jordan, is that the folks who are responsible for donating out the medications would actually apply for that position. The idea is that the state helps them out, it's efficiently run so that it doesn't become an overburden for any one particular site. Pharmacies will also always have the option to opt into this. So if they're thinking, I don't have the staff, I don't have the time, there's no mandate around it.
This is an interesting concept that I don't think anybody's really ever thought about before. It's going to be interesting to see how this shapes out and if it's effective, Anusha.
Yeah, and you know what? There's actually several states that have been pursuing or already have similar programs like this. Colorado has a version of it, but it was pretty limited, right? So the idea here is, how do you make it accessible? How do you get more medication? How do you just make the whole program easier? And that's what the bill is hoping to do. It was actually studied 2 years ago. That's influencing how this bill is being written right now.
Yeah, get it to be more widespread, put it in front of more people to opt in, yeah.
It'll be an interesting debate for sure. Anusha.